Okay, question number 7, postpartum, high risk. This is about Betty. What other physical assessments do we need to include in her care? So we want to look at the past blood pressures that she may have had postpartum hypertension. So we want to maintain magnesium for at least 24 hours so that we can possibly prevent preeclampsia. 2 high blood pressures in that 4 to 6 hour period is what indicates the hypertension. We also want to get the doctor to prescribe her a PO medication, an antihypertensive med for her, if she's not already on one. We want to check her DTR since she is on MAG, and we also want to check her respiratory rate and the urine output because if she is on MAG, the urine output could go low. We want to make sure she's not oliguric. We also want to check the perineal area because she had the laceration, the 2nd-degree laceration. We want to make sure that she's not bleeding, and we want to continue the fundal massage as well. As part of our assessment, what specific questions would we ask Betty to complete our assessment? We would ask her if she's ever been diagnosed with hypertension and is she taking any medications for it. I would also ask if she's had any headache or vision changes. Is she got increased swelling in the legs or anywhere else because she could have potential DVT. Ask her about her diet and her exercise because we also want to know if we can put her on a low sodium diet. And then what is Betty at risk for? So I said she would be at risk for postpartum hypertension. And so postpartum hypertension is when the blood pressure remains high even after birthing the baby. So normally blood pressure in a preeclamptic patient will go down after giving birth, but in Betty's case, it did not happen. She still has a blood pressure of 155/101, which is grounds for that high blood pressure. This puts Betty at a really high risk for hemorrhage, and it could also result in DIC if it gets that bad. So due to the fluid shifts in her body related to the hypertension, we can't afford for her to have any sort of massive blood loss. And this puts Betty at an increased risk for chronic hypertension now and later in her life as well, in addition to having hypertension in a repeated pregnancy if she does decide to get pregnant again. Postpartum clot formation is also a concern for us, and this could potentially result in a DVT or even a pulmonary embolism for Betty.